Good morning, everybody. My name is Leonda Solway, and I'm a transition coordinator with the First Nations Health Consortium. Before we start our session, I just want to always do a land acknowledgement in a spirit of reconciliation. We acknowledge that we are on the traditional territory of the Blackfoot Confederacy within the Treaty 7 Nations. We acknowledge the knowledge keepers now and take a moment of silence for those who were taken too soon in the recent tragedy in Siksika. Thank you. As I've stated, the Siksika, or the First Nations Health Consortium, has representation from all three treaty areas in Alberta. We represent Treaty 6, 7, and 8, and our stakeholders are from the four main health centers within each treaty: Big Stone Cree Nation, Giteskinow, KTC, Muskogees, and Siksika Nation. Our agency is the only agency to have a tripartite MOU signed between the Government of Canada and the Government of Alberta to support the seamless coordination of access to both federal and provincial programs and services needed by First Nations children on and off reserve. We provide a regional coordinated approach by enhanced service coordination to all First Nations residing on and off reserve, First Nations people residing on and off reserve. And approximately 47% of our applications are from off reserve members. So we're pretty much at half and half. Our solid understanding of the application requirements of Jordan's Principle ensures families are supported throughout the process, increasing the likelihood of a complete application and appeal submission to Jordan's Principle. What we do for children and families. For children and families, our mandate is to connect children to health, social, and education services, support families with applying to Jordan's Principle, and advocate for First Nations children. Why we're here. Jordan River Anderson was a First Nations child from Norway House Cree Nation. He was born with complex medical needs and required hospitalization. When Jordan was 2 years of age, his medical team determined he could go home with the aid of home care. The home care included things like accessibility for Jordan, items that would make his stay at home comfortable. Due to the dispute between the federal government and the provincial government as to who would pay for those in-home supports, Jordan was not able to go home. Instead, he stayed at the hospital, where he was well enough to be able to go home. And at the age of 5, he passed away in hospital, never having spent one day at home. This dispute spurred an advocation by the First Nations Child and Caring Society in 2007 for all First Nations and Inuit children to receive supports and services through the creation of a Child First initiative in his name. The initiative calls upon the government of first contact to ensure that all First Nations children have access to public services on the same terms as other children. As a result of this, there were multiple Canadian Human Rights Tribunal rulings. First Nations and Inuit children now have equal access to health, social, and education services, both on and off reserve through Jordan's Principle. So who can access Jordan's Principle? The Canadian Human Rights Tribunal has released different rulings since the beginning of Jordan's Principle. And most recently, the rulings that they have released now they outline 4 areas of a child being eligible for Jordan's Principle. So one is a child registered or eligible to be registered under the Indian Act. What this means is if a child is not registered, is he eligible to? Can we find lineage back to his nation? If the child has one parent or guardian who is registered or eligible to be registered. So this includes that parent, maybe that parent lost status under whatever circumstances, but is now eligible to be registered and under any one of the bills within the Indian Act. So that child can apply for Jordan's Principle. The third one is, are they recognized by their nation for the purposes of Jordan's Principle? Are they somebody that is ordinarily a resident, which is the fourth one, of a reserve, and the nation identifies them to be eligible for Jordan's Principle? How this impacts Jordan's Principle applications is it's opened up a new realm for those children who were adopted by non-Native parents. Those children can now come back, and if we can somehow trace the lineage back to the birth parent, even though those children are growing up off of the reserve and with non-Native parents, they can apply to Jordan's Principle. So this has opened up a new avenue for a lot of children with disabilities. How to access our services. By accessing our services, when you call in, okay, can you hear me? Okay, so calling in to FNHC. When you call in, our number is 1-844-558-8748. And you'll be directed to an access worker. Once you speak to that access worker, you will give your demographic information, identify the need of what you're seeking a request for, and the access worker will have you sign a consent form. Once that consent form is signed, you'll be able to access the services of the regional service coordinator. So the regional service coordinator will then get the file. They will contact you and they will discuss with you what needs that you have currently. So say you're calling just for an EA. That regional service coordinator, through their enhanced service coordination, should be able to speak with you and see if there's any other needs. Sometimes when we get calls, it turns out to be one need, but we end up helping with the whole family. And so our mandate is not to just help for the immediate need, but to see what we can help that child with in the future, or with other needs that would help for their wellness. So once you've discussed that with the regional service coordinator, and all information, they'll assist you with getting the supporting documents. So supporting documents that we request are usually those that will link that need to the request. And what we do is sometimes we won't take on all of that because we carry so many files, but we rather help to empower the parent. So we'll give the parent a little bit of homework to go out and get some of the documents, and I always say, if you get stuck, tag me in, because then I can jump in and I can start getting those documents. Once we get the documents in, application request is into Jordan's Principle. The regional service coordinator acts as the advocate for the parent with the government. So then we have back and forth discussions with Jordan's Principle on how we can push this application to be approved. If once the application is adjudicated and a denial is given, we then go to the process of appeal. So we support you through the whole entire process. So examples of Jordan's Principle application requests. These are some of the examples that we have done for requests. This slide is a little bit dated because this shows what Jordan's Principle has done between 2016 and 2020. There are 2 years to be added to this, and that number will greatly increase. Aside from all of these, we have done some other things that are possible through Jordan's Principle. One of them is accessibility fits on housing. Those are a little bit more complex. They require a lot more documentation, but it is possible. The most recent thing due to the pandemic has been Chromebooks. Chromebooks are something that was not, they sent everyone home, but they didn't give them all the tools to be there. And so we've helped with numerous applications for Chromebooks. The substantive equality that we talk about when we're asking for support letters and supporting documentation. Substantive equality is based upon, it comes from normative standard. Under the government, a normative standard is something that means health, social, and educational standards for the average Canadian child compared to that of First Nations and Inuit children. So is this product or service normally available in Alberta or through other publicly funded programs such as non-insured health benefits or through extended health benefits? So when accessing, say, medical requests through Jordan's Principle, we will always ask, have you gone through the agency of first contact, meaning NIHB, or is it your own insurance? What can cover it, and what does Jordan's Principle? If they can't cover it, then we need documentation that they can't, meaning a denial letter, or that maybe they can cover a portion and then the rest you need assistance with. So it depends, and it's on a case-by-case basis. So when an application is submitted to Jordan's Principle, it considers the needs and circumstances of First Nations children, which could be cultural, social, economic, and often due to disadvantages because of past mistreatment of First Nations in Canada. So then we look at substantive equality. Substantive equality is a set of 9 questions that Jordan's Principle, the government portion, has come out with that asks how that child is disadvantaged. How can we, how does it identify the disadvantage, either through maybe 60s Scoop, maybe Indian residential school, maybe addictions or trauma, and can we help that child base that so that we set the precedents for this child to have those services going forward. So this is a little bit of I guess a picture that shows where when we look at substantive equality, giving equality does not help our First Nations children. You give everybody the equal place to stand, they're still not reaching. If we give them equity, then they can thrive, then they have equal opportunity. But reality, our First Nations children sometimes fall far from equality or equity. Once we have taken the application and we look for supporting documentation, we get that in, and if the application is approved, we then move to looking at how the payment will be for the service. And what we try to do is we try to make it as seamless as we can so that the parent doesn't have to worry about paying for it or moving the funding back and forth. I will say, if it is a reimbursement that a parent has applied for, then that reimbursement will go directly to that parent, but the process is the same. So the process to obtain the financing or the funding can either be, when it's done by the service provider, they submit a direct deposit form, financial privacy consent form, and then any other necessary forms related to the approval. So you'll get an approval number, you'll get the amount, and then the invoice is usually submitted via email to the Service Access Resolution Fund, otherwise known as SARF. SARF is our financial department that pays all Jordan's Principle approvals. So if it's approved, it comes through that fund. And usually that portion should not take more than 15 days. However, I'm not on the financial side, so I can probably be found in the wrong. So Moving on, are the other options that Jordan's principal offers are group requests. And so a community managed group request for multiple children are appropriate when the needs of a child or youth seeking services is more effectively met in the context of the collective needs of a defined group. Some examples of a group request might be, say a group of parents came together and wanted to submit for an accessible playground. And so then they would get together, they would identify how many children with disabilities that are in need of that accessible or sensory playground, draw up a proposal of type, put down their diagnosis as on a template, and all of this we can send you the templates for. It does get a little bit complex, but once that's put together, that group proposal is then sent to Jordan's principal. So it has to have budget. It has to say what are you looking to do? What is the cost? Who is involved? Do you need extra payments for this? Who is helping you? Have you done any funding? Once that is sent, usually Jordan's principal will look at that, and then they will assign a specific focal point to work with the requestee. The other part of FNHC, which is really new for us, is our transition support services. So we are just now kicking that off. And myself, as well as my colleague, Robin Ross, is the youth transition coordinators for the South. We currently are a team of about 6 people, and maybe the other 4 are, there's 3 of them are management and 3 that are in transition and registration. And so what our purpose and process is to provide those youth who are aging out, either through CFS, maybe they need to start looking at age, maybe they just need some assistance with turning into adulthood, to navigate them and provide a navigation through services. The process is basically the same, coming into when you call into First Nations Health Consortium. You'll still call an access worker. They'll receive the call, and then that access worker decides which stream and which service area should be looking at this file. If it's a child under the age of 18 and it's everything just that child needs through Jordan's principal, it'll go to an RSC. But while it's at the RSC, say that child is 14 or 15, and they find out this child may have a disability or may need some services with transitioning, then they can send that file also to a transition services coordinator who can get involved, and then the 2 of them team up to help this child. Say that we find that transition services is involved with them, Jordan's principal, there will be requests, but that child is not registered. Then we will send that to our registration coordinator. We are recently just now getting in, I guess, in depth with Indigenous Services Canada, and soon we'll be able to offer registration services through the First Nations Health Consortium support services team. So that will be assisting with applying for treaty registration, and we will keep you all posted once the training is complete and we are ready to go live with that. So once that happens, the service area completes their file as per the policy they operate under, and then it's sometimes it can just continuously go until it reaches finality and we're able to close the file. Our purpose, like I said, is making connections, linking young people and required support services both off and on reserve. Part of our plan is to the same in line with Jordan's principle, identify gaps in services, participate and facilitate in transition meetings. So sometimes we are a team participating with Alberta Children's Hospital, maybe it's CYOC, maybe it's AGE. It just depends on the service provider and the meetings that we attend with families. We assist and educate families to understand systems and access services, do referrals to community agencies, apply and offer application assistance for government agencies, community networking, why I'm here, and navigation of agencies, programs, or services. So part of this is how Jordan's Principle and transition services kind of meet in the middle with a youth is in the disability area. So a youth who is under disabilities as a child will usually reach out to FSCD for support services. Once that youth gets to the point where they are aging out and going into applying for, they will need to apply for AGE or PDD off the reserve. The request, say, for the assessment process is a little bit different. For a younger child, it's more education-based and how we can support that child under there. With youth transitioning to AGE, that psych ed assessment has to really focus on that functioning portion and how that functioning, how that assessment is going to support their application for disability. So we answer, I know there's probably a ton of questions, we can answer them if we have the means, and if you need to reach out, you can reach out to us for more information on that. Most recently, we did also do a presentation training with CRA, and so there's we all know how to apply for the disability tax credit and to offer our services to our parents. So our supports, these are our two streams. One is growth and preventative, one is supporting and critical. So life skills, ID, transition checklists, how to apply for, or how to make an appointment, how to open a bank account, cultural supports, education, how to find funding, or the critical side where we're applying to GOA programs, FSCD, AGE, PDD, or CRA supports. So the advantages of our enhanced service coordination, both within the regional service coordination side with Jordan's Principle and with transition services, is we reduce the stress of navigating systems with both applications and seeking applications through for adulthood. We link families to provincial and federal resources. We work collaboratively with other service providers. We advocate all the time for children, families, and communities. We support the family in telling their story through substantive equality. We provide assistance to families with the appeals process, and we support community-driven applications when coming to Jordan's Principle. This is our information. To reach us, you can call toll-free 1-844-558-8748. Please visit our website for more information and to view our annual report. It just came out and it's awesome at www.abfnhc.com. Our support services email is support.services@abfnhc.com, and to just send a general email to First Nations Health Consortium, and then they will sort it out and send it to one of our agencies. No child forgotten @abfnhc.com. So I thank you for listening to my presentation, and I hope that we are able to assist you with your needs, either transition or through Jordan's Principle.
Thank you, Leonda. You're, as always, a wealth of information, and Robin for joining us today. For those of you who had missed the majority of the webinar, yes, it will be recorded. It is being recorded. Also, if you need any additional assistance in applying for Jordan's Principle or need some guidance in filling out the application, I am here as well, Dr. Proyo Lumen-Healy at the Siksika Health Center. I also work closely with Leonda, and we navigate systems together and advocate for all children. So I am your community outreach person if you need any assistance in anything, advocating for services or supports. So right now, I will stop the recording and we will take questions that you may have. We won't be answering case-specific questions. So if you were denied funding or any to that nature, it's just asking questions about support services and processes at this point. Okay, thank you.
No questions.